information. Teen drug use is common among college students in 2016. 45% of male college students and 40% of female college students used illegal drugs. According to a report by Substance Abuse and Mental Health Service Administration, 74% of adults participating in a substance abuse treatment program started using alcohol or drugs at the age of 17. Those who began at 11 years old or younger were more likely to have multiple addictions compared to those who didn't use drugs until they were 25 or older. Mental health professionals who work with teens observe the link between depression and substance abuse in teens on a daily basis. They know from interacting with teens how closely mental health and substance use are related. In terms of regular marijuana use in high school, 36% of high school seniors use marijuana. Similar to past years, and 6% similar to past years, and 6% report daily use. According to teen substance abuse statistics, more high school students use marijuana than cigarettes in 2016. Stereotypes that make it hard for children. There are a lot of stereotypes that make it very difficult for children to be open with their problems, like how their parents already are alcoholics, so I am not, or just the fact that they don't want to admit that they are abusing substances. Anything like this can be very hard on a child, and they do not deserve to be judged, they deserve to be helped. Resources for children under substance abuse. I have Wellness Together Canada, which is 1-866-585-0445, and the kids' help phone 1-800-668-6868. What is substance abuse? It occurs when you use alcohol or prescription medication or legal/illegal substances too much or in the wrong way. Often it is a result of harmful pattern of overusing substances and negatively affects the abuser's health.
Incidents of different kinds of substance abuse in Canada. Alcohol abuse. 19% of Canadians aged 12 and older regularly drink alcohol. Marijuana abuse. 16% of Canadians aged 15 and older regularly use marijuana. Nicotine abuse. 15% of Canadians regularly smoke cigarettes. Various forms of substance abuse. Alcohol, beer, wine, vodka, whiskey. Prescriptions and over-the-counter medicine, anxiety and sleep medicines, pain relievers. Other substances include heroin, cocaine, marijuana, and cigarettes. What are the causes of substance abuse? Behavioral. To experience feelings of pleasure or euphoria, to fulfill cravings and desires for enhancing physical performance, self-medication. Environment. Difficult family situations, learning or watching others, or even peer pressure can cause substance abuse. And biological and psychological. Certain drugs create an addiction, life stage, genes, gender, stress, mental health, all can play a factor into substance abuse.
What are the causes of substance abuse? Behavioral, to experience feelings of pleasure or euphoria, to fulfill cravings and desires for enhancing physical performance, self-medication. Environment, difficult family situations, learning or watching others, peer pressure. Biological, physiological. Certain drugs create an addiction, life, stage, age, genes, gender, stress, mental health. Symptoms of substance abuse: physical, irregular heartbeat, cold, sweaty palms, shaky hands, runny nose, hacking cough, tremors or shakes of hands, feet or hands. Inability to sleep, nausea, vomiting. Behavioral, paranoia, change in attitude, silliness, giddiness, dishonesty, drop in grades, change in hobbies, lack of motivation. What are the options for treatment? Group therapy, meetings with others who have similar concerns to discuss strategies for managing substance abuse issues, residential or inpatient treatment. This is where a person stays in treatment facility for 24 hours a day. Some are just during the day, not at night. Programs offer group counseling, family counseling, and case management support. Pharmacology treatment for some addictions, medications such as methadone may assist in the treatment process. These are prescribed for doctors. Community therapy services are offered in schools, the individual's home, or facilities themselves that provide counseling to manage substance abuse issues. Prognosis. Substance abuse differs from addiction as individuals are more likely to quit or change their harmful behavior. An individual that is suffering from substance abuse must be willing to change their behavior and put in the effort to do so. For example, they need to practice dealing with stress and try to make better decisions and judgments. Besides the willpower of the individual, outside sources such as counseling and prescribed medications can help with their recovery. Impact on the individual and or those close to them. Substance abuse causes lack of motivation, which causes laziness. And being unhealthy, substance abuse can lead to death or major illness later in life. For example, drug overdose, alcohol poisoning, substance abuse can cause poor parenting, which leads to childhood trauma, or for the child to take after the parents. During COVID-19, many families were stuck at home together, and some had to live with someone who suffered from substance abuse.